Hello and good evening, guys. Welcome to today's session. I'm your host, your mentor, your educator, your friend, Dr. Hitesh, on this wonderful platform of Unacademy. If you are able to hear me, listen, and look at me, all right. If the EV is clear, give me a quick nod. I can see at my end that it is. Just let me know at your end that everything is fine so that we will start with our session for the day. All right. All right. Thank you for that confirmation, guys. Let me go in the chat section. Yeah. Hi, Shivran, how are you doing? So I hope everybody is doing good. Yes. And I believe anesthesia, from the point of view of your FMG examination, was an easy subject, right? There were like 5 questions straightforward from anesthesia, and I'm expecting that all of you have marked it correctly, right? There was a query in one question that we will address right now, but apart from that, I believe all the other questions you should be able to mark it. है ना? So, shall we begin for today's session? Just let me know in the comment section if everybody has joined in so that we are good to go for the session for the day. All right. First of all, a quick disclaimer. All the questions that we are discussing right now, they are all recall based, right? If there is any queries, if you feel that any question, anything is amiss here, you can just let me know and we'll correct it as we go forward. All right. Hi Nirmala, namaste. How are you doing? So before we start the session, let me just tell you what we have come up with on Unacademy right now, right? So it's the iconic subscription that is there right now. So if you are subscribing to Unacademy, this iconic subscription is going to give you the Unacademy Plus, Notes 2.0, and the mentoring session. Everything is combined into one entity for you, right? So make sure now when you subscribe, you should go with iconic so you get everything. What does Plus includes now? It includes your live batches as well as the recorded session, right? Everything is included in that, right? It is not just live, it is recorded plus live. And notes, updated ones, the new recorded ones that we have, the updated lectures, all the notes, along with the mentoring session that we have. All right. And yes, this recorded session includes what? It is your NEET-PG vitals, that is inclusive of all the 19 subjects, right? Everything recorded at one place. So if you are feeling some topic that you are not good at, that you want to study, that you want to go and revise along with your live classes, you can go and address that. All right. So before, what used to happen, sir, where have we taken this? Where is this session? Where is that topic? We used to be all confused with that. So that thing has been addressed now very beautifully on Unacademy. So you can easily go and check it out. All right. So yes, the first question on your screen, right? Identify this classification which is shown on your screen, right? Write down the answers in the comment section, whether this is Malampati, whether this is Friedman, whether this is Brodsky, or whether this is Cormack-Lehani classification, right? And at the outset, let me tell you, there might be 2 correct answers for this, right? Depending upon your feedback, we are going to take it up as what is the right answer for this. All right. So Renu says it's option A. Nirmala says A ko lock kar diya jaye. All right. Monica says again option A, right? All of you have to give your answers in the comment section, right? Unless and until you have this habit of getting the question, giving back the answer, getting the question, giving back the answer, your brain will not develop this habit of in the examination also, right? So you should have this reflex. It should become a reflex in your mind. All right. So Kavya says again option A. I'll tell you all of you are correct here, right? This is Malam Patti classification, right? But what did the examiner do? Examiner has given the options in such a way that it is little tricky, right? Let us look at the other classification, that is Friedman classification, Brodsky's classification, Cormack-Lehani classification. What are these, right? What is Friedman classification, guys? This is what is Friedman classification. The upper one that you are able to see, this is our Mallampatti classification, MPC that we call it, right? And we all have studied this in detail, right? In our airway examination, this is the first thing that we studied, and this question has been asked very, very, very frequently in our examination previously as well. So this is a PYQ, right? But look at the second image that you are able to see, right? This image. What is the difference between the upper one and lower image? Yes, look at the tongue. Yes, what is the difference, guys? Look at the tongue here, है So what difference are we able to see between the two? One is Mallampatti, where your mouth is open, your tongue is protruding out without phonation, right? Without phonation. So that is your Mallampatti classification. So we sit at the level of the patient, we ask the patient to open the mouth, protrude the tongue out without phonation. So that is our Mallampatti classification that we are able to see here, right? But what about second one? Here again the mouth is open, but what is happening here? The tongue is not protruding out. Tongue is not protruding out. So how it is? Just like this. So how will you differentiate? With the lower incisor teeth, whether you are able to see or not, right? So look at the difference between the two. One, tongue is protruding out, second, tongue is not protruding out, right? So what is the second one? This is your Friedman's classification. This is your Friedman or Friedman's classification, right? So what was asked in the examination, you have to answer accordingly, right? Whether the tongue was protruding out, it is Mallampatti classification. And as far as my guess goes, as far as my intellect goes, the examiner will ask you about Mallampatti, unless and until the examiner is like very tricky and he wants to like bust your A. So I don't know about that. Then it can be a Friedman classification, right? This is typically those type of question where it is like very confusing, है ना? Yes. So it depends upon the examiner's psyche, what he is trying to ask you, right? So it can be Friedman's classification as well, depending upon the tongue is protruding out or not, right? So we'll have to wait for the answers at the end of our result, like how it is, depending upon that this will be, right? So what about Cormack-Lehani classification? Cormack-Lehani or CL classification that we have already seen. This is usually done during direct laryngoscopy, right? This is usually done when we are doing direct laryngoscopy, depending upon the vocal cords that is visible, right? So these are the three things that we have discussed in our airway classification. All right. So this question can be having two answers. One is your Mallampatti classification. Second, Friedman classification. Since it was there in the option, therefore we are talking about it, right? Anju Verma, this is our anesthesia FMGE recall session, है ना? So not to worry, even if it's your first class, this is our FMGE recall session of anesthesia, the exam which was conducted just recently. All right. Next question on your screen. Which of the following undergoes Hoffman's elimination, right? Write down your answers in the comment section. Which of the following undergoes Hoffman's elimination? Very, very simple, easy question which is asked, right? Which of the following undergoes Hoffman's elimination? And your options are cisatracurium, mivacurium, pancuronium or vecuronium, right? So Renu says it's option A, that is cisatracurium. Monica, cisatra, very good. Nirmala says it's C, that is pancuronium. IELTS says it's again cisatra. Yes, Nirmala has changed her answer to option A. Very good, guys, very good. So this is a very frequently asked, and this is one of those factual questions that we have always revised, right? So Hoffman's elimination and Easter hydrolysis. Hoffman's elimination and Easter hydrolysis. Remember when we have studied about non-depolarizing muscle relaxants. When we have studied about non-depolarizing muscle relaxants, what are the things that we have studied it under the headings? One was the duration of action, structural classification, and one of the most important thing was metabolism, right? Metabolism. So most of the non-depolarizing muscle relaxants are metabolized in liver and excreted in by kidneys or excreted by kidneys. So it is hepatorenal metabolism, right? There are two exceptions for this, right? First one, for Hoffman's elimination, what were the two answers that we have? One was cis atracurium, the other one was atracurium. So atracurium and cis atracurium are the two non-depolarizing muscle relaxants which are eliminated or excreted by Hoffman's elimination and ester hydrolysis, right? What about mevacurium? Write down in the comment section, guys. How is mevacurium metabolized? How is mevacurium metabolized? How is mevacurium metabolized? Write down in the comment section. Yes. Any idea? Any guesses? Yes. How is succinylcholine metabolized? Yes. ये तो अपने को याद है ही, right? We remember this. How is succinylcholine metabolized? Succinylcholine or mevacurium both are metabolized by pseudocholinesterase, yes, or plasma esterase, right? So that is by pseudocholinesterase. Pseudocholinesterases, right? So mevacurium and succinylcholine both are metabolized by same metabolism, right? Now coming to pancuronium and vecuronium. How is pancuronium or vecuronium metabolized? They both are metabolized by this liver and kidney, that is hepatorenal metabolism, right? Clear? So in liver and renal diseases, which of the following will we use? We will use cis atracurium first. That is the first drug of choice, right? We will use cis atracurium or atracurium if it's there in the option, both of them. Why? Because they undergo Hoffman's elimination. Their metabolism is independent of your liver and kidneys. Clear? This question is clear. Very, very, very frequently asked, very commonly asked question, right? Next question on your screen. Fluid of choice for surgeries, right? Fluid of choice for surgery, right? Which fluid it is? The one that we give intravascularly or intravenous, right? Which of the following fluids do you use when we perform or when the patient undergoes any surgery? Options are blood, B crystalloid, C colloid, or FFP, that is fresh frozen plasma, right? So whenever we have discussed about fluid, remember, whenever we have discussed about fluids, we have discussed this under two headings, right? Crystalloids and colloids. Colloids and crystalloids, right? So when we have discussed about fluids, we have discussed it under two headings. One is crystalloids, the other one is colloids, right? So what all are the fluids that we discussed under colloids, right? This includes your blood and blood products. Also the synthetic ones. These are all naturally occurring colloids, right? Blood and blood products. But what about synthetic ones? The starches, right? Pentastarch, hexastarch, all these things are under this colloids, right? They are high molecular weight fluids, right? But what about crystalloids? Crystalloids are the ones that we have discussed under three headings again, right? They are isotonic, hypotonic, or hypertonic solutions. These are less molecular weight as compared to your colloids, right? So which one do we use most frequently? We use isotonic crystalloids for surgeries. Why? Because they are in sync with our blood and the intravascular compartment volume does not changes, or the molarity of those does not change much, right? So which is the isobaric or isotonic solution, right? Which is the isotonic solution that is used? One example of that is normal saline, that is 0.9%, right? Exactly correct, Nirmala. Yes, Saurav. Yes, Kavya, albumin, dextrans, very good. Those are all colloids, very good answer, right? So NS, RL, yes, zero point 0.9, Renu, very good. So 0.9% normal saline is your isotonic solution. The other example is RL, that is Ringer's lactate, right? So which one do we use? We use this Ringer's lactate, that is your RL solution is used the most, right? So what is this? The Ringer's lactate is the solution of choice or crystalloid of choice that is used for surgeries, right? So correct answer here is crystalloid, and crystalloid also which one? Ringer's lactate, that is RL is what we used every patient, right? Almost every patient we use it, right? Do we use hypotonic solutions? What are the examples of hypotonic solutions? Yes, which has got the tonicity less than that of our blood, right? So I use hypotonic solutions, right? Normally it is in the range of 290 to 310, that is what we use the isotonic. Below that is our hypotonic solution. So which one are those? Dextrose, 5%, right? Do we use it routinely in the surgeries? No, right? And do we use colloids routinely in the surgeries? No, right? Wherever indicate, we use always crystalloid first, and then we go with other solutions depending upon the blood loss, interstitial volume, and all those things considering into our parameters. All right, clear with this? Moving on to the next question. Which of the following is not used in ACLS, right? ACLS, what is the full form? Advanced Cardiac Life Support, right? So which of the following is not used in ACLS? Options are amiodarone, adrenaline, sodium bicarbonate, or high voltage defibrillator. Which of the following is not used? Very important word, and we have to make a note of this. This is not used, right? What we call it? We call it girlfriend googly questions, right? Everybody remembers that? Yes. Whenever a boy goes and proposes a girl for the first time, what is the reaction? I love you, but as a friend, right? So this but, not, if not, except, I have told you time and again, right? Whenever these negative words are there in the question, you have to read the question twice and thrice and then answer, right? So which of the following is not used in ACLS, right? ACLS means Advanced Cardiac Life Support. Advanced Cardiac Life Support, right? So which of the following is not used in Advanced Cardiac Life Supports that we are doing, right? So it is, the options are amiodarone, adrenaline, NaHCO3, that is soda bicarb, or high voltage defibrillator. So what happens in ACLS, guys? What happens in ACLS? In ACLS, you have got all the monitors available with you, right? All the monitors available with you, right? So whenever you have the monitors, you attach like ECG, SpO2, everything is attached, right? Plus, you have intubated the patient with your endotracheal tube, put the patient on ventilator. Again, the monitoring in the form of EtCO2, that is capnography, has been attached here, right? So when you attach ECG, what do you get? You get two types of rhythms. One is shockable rhythm. Second one is non-shockable rhythm, right? So which are the shockable rhythm, guys? Which are the shockable rhythms? Which are the shockable rhythms? The best answer for this is VF and VT. You should remember these two rhythms always. So VF and VT, these are the shockable rhythms. Very good IELTS. So these are the shockable rhythms. Now what do you mean by shockable rhythms? Whenever you see these rhythms on the monitor, you should deliver the shock as soon as possible, right? Delivery of the shock as soon as possible. Now how do we deliver the shock? It is delivered with the help of defibrillator, right? It is delivered with the help of defibrillator, right? So as soon as the shock is delivered, or how is the shock? The high voltage current, right? Defibrillator, usually it is in the range of 200 joules when you're using biphasic, or 360 joules when you're using monophasic defibrillator. So this is high voltage shock, right? So this option is ruled out, right? So we deliver the shock as soon as possible, correct? Now whenever we have delivered the shock, what do? We again institute or start with one cycle of CPR, and then we again assess for rhythm, right? If the rhythm is again shockable, we deliver the shock, right? Now when we are having this conversation, when the patient is undergoing this cycle, in between, what does the nurse does? She secures an IV line or IV cannula, right? And once the IV cannula is secured, what do we give via the IV cannula? We give adrenaline. We give epinephrine or adrenaline via IV, right? How much it is given? 1 mg or 1 ml, that too given stat, right? 1:1000 dilution given stat, that is bolus adrenaline is given, right? So one drug which is given here is adrenaline. So can we rule out this option B? Yes. Now again the cycle is repeating, right? Again we are looking at the rhythm. If the rhythm is shockable, we deliver the shock. After delivering of the shock, we again give one cycle of CPR. This triangle is continuing, right? This triangle is continued, and we are giving adrenaline every 3 to 5 minutes. Every 3 to 5 minutes adrenaline is repeated, right? Every 3 to 5 minutes adrenaline is repeated. Clear yahan tak? Any doubts so far? Now when you are giving adrenaline and when you see that the patient is in VF or VT, what are those? VF or VT are arrhythmic rhythms, arrhythmias, right? These are the rhythms. So which is the second drug that we use? We use antiarrhythmic drug, that is your amiodarone or amiodarone, or by the trade name cardiorone, right? So we use the second drug, that is amiodarone, right? Right, Kunal, Monica, very good IELTS. Yes, wonderful. Yes, Saurav, we can use amiodarone. So can I rule out amiodarone here? Yes, I can rule out amiodarone. So what we are left with? We are left with soda bicarb, right? So which are the two drugs that we use in ACLS? That is adrenaline and amiodarone. Now, God forbid, you are at a center where amiodarone is not available, right? Now God forbid you are at a center where amiodarone is not available. What will you do? Yes. In such conditions, instead of amiodarone when it is not available, lignocaine can be used. Lignocaine is also antiarrhythmic drugs, we have seen, right? Class 3. So we will use lignocaine, right? What is the dose of lignocaine again? It is 0.5% or 0.5 to 1.5 mg per kg of body weight. 0.5 to 1.5 mg per kg of your dose of lignocaine we will use, right? Amiodarone, stat 300 mg followed by 150 mg. Adrenaline 1 mg or 1 ml stat given every 3 to 5 minutes. Clear everybody? So these are the drugs which are given in your ACLS protocol, right? And what are the non-shockable rhythm, guys? Pulseless electrical activity or asystole or asystole, right? Pulseless electrical activity and asystole or asystole. Clear? Amiodarone in shockable rhythm, adrenaline in both shockable as well as in non-shockable rhythms, you will give adrenaline. Amiodarone only in shockable rhythm, but adrenaline repeated every 3 to 5 minutes once the IV is secured in both shockable as well as non-shockable rhythm, right? Exactly correct, Monica, Dr. Nisi, Kavya. So what is the answer for this? Which is the drug that we are not giving? That is our soda bicarb, NaHCO3. Clear? Understood? Next question, identify the needle, right? Now we can say that this question is an overlap of surgery, or this is a mixed question that we can say. But looking at the options, you have to know that this can be a question from anesthesia or not, right? So identify the needle which was asked, right? So first and foremost, you should have seen spinal needle, you should have seen epidural needle, you should have seen how do we go about with lumbar puncture. Only then will you be able to identify this needle and let know the function of this as well, right? So yes, Renu says it is option C. Dr. Nisi is asking, amiodarone is contraindicated in ACLS protocol. So Renu says option C, very good. Monica says C. Kunal says non-shockable. Yeah, that was previous. Very good, Nirmala. Yes, Monica says it is Very's needle. Very good. So see, whenever we are discussing the instruments, we have already seen spinal and epidural needles, right? Epidural is also known as your Tauhees or Tauhees needle, right? And what about lumbar puncture? For lumbar puncture, we use this spinal needle itself, right? So if you want, we can rule this options out straight away, right? Now, if you're able to see, there is a lever here and there is a side port attached to it, plus there is an insertion port here along with it, right? So this is nothing but this is your Very's needle, right? This is your Very's needle. Where do we use Very's needle? It is usually used by surgeons for laparoscopic surgery. Why? To create pneumoperitoneum. To create pneumo means air. To fill air inside the peritoneum, right? So that it is inflated and you get area to work upon with your instruments, right? So this is a Very's needle which is used to create pneumoperitoneum. Alright, this is from your surgical aspect this question is asked, but since the options also included the anesthetic needles that we use, spinal, epidural, lumbar puncture, so therefore one must have got confused, but this is a Very's needle which is used to create pneumoperitoneum. Alright, so Kunal, Monica, Renu, everybody has given almost correct answers, not to worry on that front. So now assess yourself, guys. We are again going to repeat. Identify the needle. The answer is Very's needle used to create pneumoperitoneum. Option question 1, right? Which of the following is not used in ACLS? Soda bicarb. Question 2. Fluid of choice in surgery is crystalloid. Question 3, right? Which of the following undergoes Hoffman's elimination? Answer is cis atracurium. Question 4. And this particular identify the classification. I'll label it as Malampatti, but if the tongue is not protruding out, it has to be Friedman, right? So these are 5 questions which were asked from anesthesia. As expected, every time 3 to 6 questions are always asked from short subjects, right? Now I hope all these 5 questions are clear in your mind and all of you have marked it correctly, right? Okay? Any doubts? Any doubts, guys? Just let me know in the comment section if you have any doubts. So make sure you are using the iconic subscription whenever you are subscribing to the Unacademy subscription from here on, plus which has got the live as well as the recorded classes. Notes 2.0 will be given to you and the mentoring session would be done. And to subscribe to these, you can use the code Dr. Hitesh, right? To get that extra benefit, you can use the code Dr. Hitesh. All right. So that's all from my side, guys. I hope you enjoyed today's session. Thank you, Nirmala. Thank you, Renu. Thank you, everybody, for joining in, right? So this was the anesthesia recall in the last exam that was just concluded. Make sure you are solving all the previous year's question so that you are well aware of the topics, as well as you are well aware of the trend that is going on, right? And as expected on the expected lines, the question was also there from anesthesia, at least I can say. All right. So thank you all for joining in. Wish you all the very best. My prayers are there for your results, and I'm expecting that you will cross the line. All right. So until we meet again, guys, this is your host, your mentor, your educator, your friend, Dr. Hitesh, signing off for the day, guys. Bye bye. Take care. Stay blessed. Stay disciplined, and stay motivated. Bye bye.